Dear student, today I am going to explain a new topic what I already discussed in short, and I have told you that next day I will discuss in details about all this part. Today we are going to discuss in details about different route for the parenteral drug administration. First thing we have to learn what is parenteral. Parenteral is a word which is consist of two words. One is para, second one is enteral. Now, para. Para means that is beyond. Beyond means that is far away. And enterus. Enterus means intestine. Intestine. Or we can tell complete GIT. That means parenteral is a route of administration where we directly administer the drug into the tissue fluid and the blood without passing enteral mucosa by using injection or infusion. So here when we administer drug, we administer directly that drug into the tissue or indirectly to the blood by infusion or injection. And in this, drug doesn't undergoes metabolism under intestine. So they are called as bypass metabolism. That's why this is called as parenteral, that means beyond intestine. Because it is doesn't metabolize in intestine, that's why it is called as parenteral. Now we will discuss about different parenteral route by which we can administer drug. तो अभी हम लोग डिस्कस करेंगे डिफरेंट पाथ फॉर पेरेंटल रूट जिसके माध्यम से हम लोग कैसे डिफरेंट रूट पेरेंटल रूट के माध्यम से ही ड्रग को अंदर एडमिनिस्टर कर सकते हैं. इसके अंदर मेन तीन चीज आता है. एक आता है सबक्यूटेनस जिसको हम शॉर्ट में बोलते हैं एससी. दूसरा है इंट्रामस्कुलर जिसको हम लोग कहते हैं आईएम. एंड थर्ड वन इज इंट्रावेनस. That three are the most important and most usable routes of administration for parenteral drugs. So now we will discuss one by one with all routes included in parenteral. The first thing we will discuss that is intramuscular. In that what we did, we inject the drug. We inject the drug or infuse the drug into the muscle. Here in different muscle we can use like in deltoid muscle, in triceps, in femoris, okay, now I am going to explain about the intramuscular route of drugs for parenteral drugs. Here what we did, here we directly inject or infuse the drug into the different muscle in our body. That includes triceps, femoris, and deltoid muscle. That intravascular is generally used because that is low risky and that is self-injectable. And for whatever route for parenterals I am discussing about, they have a specific angle of injected in which we should inject that drug into the body so that it doesn't cause any irritation or any other side effects. That I will discuss later in which angle, which kind of parenteral drugs we should administer in. Next point, what we will discuss about the intravenous drug, which is going to injected in venous route. That is called intravenous. Here what we did, we use drug as bolus or we can use drug as solution. Here bolus drug is directly injected or solution is directly infused into the veins of the body so that drug can directly mix into the blood and can reach into the tissue where that drug is required for. And this is very risky process and very risky route. That's why it is not used that much. And because it is risky, why? Because that is used for generally high important tissues in our body like brain, heart, etc. So for that route of drug administration, we need a specific skilled personnel. The last and the important what we are going to use for parenteral drug administration is subcutaneous. That is generally injected or infused the drug directly into the subcutaneous part of our skin where different type of nerves are present. They are nerves rich, but they are less vascular. They are less vascular. That's why we use that drug directly into subcutaneous, directly injected into the body, so that drug can mix into the blood and can show its action. But for the disadvantage for that route, that is slow release drugs can't be administration by that route. Now we will discuss about the different angles. What we have to remember when we are going to administer a drug by different route of parenteral administration. For that, I will show you a figure. That is our skin. That is epidermis. The next layer in our body is or skin is dermis. Here different blood vessels are there and nerves are there. That is called subcutaneous. And under that we have muscles. Now I will tell you the different angles where we have to administer the drug. First is intramuscular. Intramuscular, we generally inject the drug directly into the muscle, and for that angle should be 90 degree. And the second one is intravenous, that we generally inject in dermis part because here different type of veins are there. So here we did injected by intravenous. Here that angle should be 45 degree. And the last one is subcutaneous. Here we generally administer the drug or inject the drug directly into the subcutaneous part where different nerves are there but they are less vascular. Here the drug is directly administered by the injection at the angle of 25 degrees. That all degrees are very important and we have to remember during the administration because not maintaining that angle can cause a different side effect including irritation, inflammation, etc. and other side effects. Okay, during studying of route of administration, I have already told that for administration of the drug, there are different routes are available for that administration of drug. The most and commonly used for the emergency cases are parenterals. In parenterals, also different routes are there. What I have already discussed in previous session. So today I am going to explain about what are other possible routes, what is available in our India and throughout the world for administration of drug except parenterals. So today we will discuss about other route of administration rather than parenterals. Other routes. Except parenterals, there are different possible routes are there. In that they are oral, second one sublingual or vocal, cutaneous or we can tell it is topical, then inhalation, and others are also there, rectal or rectal and vaginal. Now I am going to explain details about all that route that is available for the route of administration of drug. The first and foremost what is used except parentals in our daily life, that is oral. That is most commonly used in our daily life because that is the most useful and convenient for a patient or for a normal human to consume by yourself without any skill or without any requirement of personal or professional expertise. In that, generally in non-emergency cases, which are normal diseases in our normal life, for that treatment of the other disease, we generally use that oral route because that is more convenient for the patient who are not in that much emergency situation. They can easily take drug by oral route with water through their buccal cavity, and that directly will go through the fast pass metabolism and pass through ADME. For oral, bioavailability is very less because when the drug is taken and administered, when it is reaching to the action site, the amount of the drug is decreases, so their bioavailability is so less. So that is one of the disadvantage for oral route. And the other oral route problems are many drugs are there which are not good in taste. Not good in taste. For that also we can't take through that oral. But for that problem we can overcome easily by adding different type of sugaring agent or coloring agent or flavoring agent which can mask that palatable taste and can make it easy to swallow and for consume for the normal patient. But in emergency cases it is not used that much because it has very slow work of rate, so it will take more time to get recovered. For emergency cases it is not used at all. The other problems are like bioavailability, I already told, slow action, I already told. That's why they are not used in emergency cases. For oral, different dosage forms are there. Different dosage forms are there. Solid dosage forms are there. Emulsion or suspensions are there. Liquid doses are there. Semi-solid dosage are there. In solid, we generally use tablets and capsules. In the liquid, we generally use elixir or syrup, like we use cough syrup, everything like syrup we can use, tablet we can use like paracetamol, dolo, what we are going to take for normal fever, normal cold, for all these things we can take, that is solid dosage for the tablet and capsule. In liquid we have syrup. In emulsion we already know emulsion means liquid plus liquid, some double dose or bypassing liquid forms are there, that also can be administration by oral routes. The next route we are going to explain, that is sublingual or vocal. In that what we are doing, in that the drug is not directly taken by drug with water, not directly to our GIT. In that what we have to do, we have to break the tablet into small pieces and we have to keep it under our tongue for slow release, and we have to keep it under tongue and it will show its action and it will get absorbed into our body by using saliva. For that also different drugs are used, like paracetamol we can take, indomethacin we can take, all the drugs we can use. Indomethacin is anti-inflammatory drug, what we will discuss in upcoming classes when we will go in details about specific drugs and their usage. Paracetamol is used as analgesic and antipyretic. The next route what we are going to discuss after sublingual and vocal, that is rectal or vaginal. These routes are generally used for the patients who are unconscious and who don't have patience for taking drug every day and who can't swallow that drug easily, and who doesn't like unpalatable taste of tablets, capsule and other solid dosage form. For them, rectal and vaginal is used because they have some advantage also over normal solid dosage forms or oral drugs, because rectal and vaginal, they are used generally in the rectal part and vaginal part of the region, so they have more viability and they have more rate of absorption, more more rate of absorption than normal or solid tablet and drugs. So they can easily use as rectal and vaginal. There are different types of dosage forms are there which are going to use in rectal and vaginal. Someone is suppositories, or we can tell traceries. In that, the drug is made into a cone type shape and they are inserted into the rectal and vaginal region, and they are going to release that drug in slow manner, and for that the drug can easily reach into the site of action in more amount and absorption also will be more. Like diazepam. Diazepam is a drug what comes under benzodiazepine that can be used as antipsychotic or sedative of hypnotic drug, that also we are going to explain later when we will go in details about different classes of drugs. There also we can discuss about all these drugs, how they are going to take and what is the classification. All these are main part what I will go in discuss slowly day by day. Then the next part is topical. What's it topical? That is over the skin. That is epidermis. Here we generally what we do, we didn't take any drug to our body inside. Here that is only for external usage. You can generally see in topical usage drugs, they are strictly written that they are only for external use, not for internal use, because they are topical in nature. They are intended to use in external part. In topical, what we did, we took different dosage forms are there like ointments, gel, powders. What we are generally applying on the skin by using our hand or by wool or by some cotton, like that we can directly apply on our skin. According to that, there are two types of dosage form are there: linters and liniments. In linter, that is also a gel type what is going to apply in skin, but for that we have to use cotton swab or cotton or any wool, like that we have to apply indirectly. And for liniment, that we can use directly on the skin by using our another hand, and we can rub on the skin and we can use as a topical drugs. Like different creams, ointments are there which are going to use for that topical for treating different allergic reactions, skin reactions, different reactions. For that we use that topical drugs. The next and little bit costly and other route is inhalation, or we can tell nasal route. Some drugs are there which generally can't pass blood-brain barrier. For all the drug, we can't take throughout other route of administration because they can't pass blood-brain barrier. To cross the blood-brain barrier, we have to use more lipophilic drug which can easily pass through the lipophilic membrane and can pass easily blood-brain barrier. The most and more favorable path is nasal route, because through the nasal route, high lipid profile or lipophilic drug can be administered that can easily pass through that blood-brain barrier. So in that what we did, we use aerosols or inhalers, where the drug is soluble into the propellant and can directly spread through our nose, and we can inhale it as a gas form. We will discuss later when we will go through aerosol inhalation different routes. Now just remember that for inhalation we use high lipophilic drugs which can easily cross blood-brain barrier through nasal route. Here the drug is administered as a spray and we are taking directly through our nasal route so that it can directly pass through that blood-brain barrier. For that we are using that inhalation or nasal route. The most usable routes are bethamical or betmizone that is generally used to treat asthma. So for that asthma treatment, COPD treatment, different drugs are used as gas form that can be inhaled into the body through nasal route. So by that I already completed the other routes of drug administration rather than parenteral. Next day we will go through pharmacokinetics and other topics. Whoever wants to study all the topic what I am covering in each day, all that are written in handwritten notes which are already uploaded in my Google Drive and they are given into the description. You can check my description. There are already Google links are given. From there directly you can click and you can download notes for each classes. Thank you.